call yourself a cosmetic surgeon doesn't necessarily mean that you even have any formal training in cosmetic surgery. To be called a plastic surgeon means that you had to go through, most people go through another residency training before. The majority go through general surgery. I actually happened to go through head and neck surgery and facial plastics before I went to general plastics. And then you have to complete another 2 or 3 year residency just in plastic surgery. And then there's a process that takes about 3 years after that where you get a board certification. Almost all of our surgeons are board certified, in fact all of them except for one who's still early in his career. So I think the big advantage of coming to a place like this is that we're all plastic surgery trained, which means that we're trained in plastic and reconstructive surgery. We've all done a legitimate residency that's accredited. And so we're not dermatologists or family practice or geriatricians or general practitioners dabbling in plastic surgery. We're people who are trained to focus on that. I think one of the greatest things about working at Strax, especially a young, energetic physician like myself, is that there are so many people here who have so much more experience, so many more years of experience, that if I have any difficult cases or complex cases, I can always count on getting 5 or 7 different opinions. And that, for me, has been something that's really helped me grow very rapidly and develop my practice, and vice versa. I think having younger physicians here also injects novel techniques and a new energy back into a practice, so that the benefits go both ways. Luckily in this patient population, most people are very healthy. Most surgeries are relatively straightforward, but sometimes things can be difficult. There may be anatomy that doesn't look familiar. Sometimes it's just good after you've been in surgery for a while to have another set of eyes look at the same place, because 2 different people, especially fresh eyes, can see things in a new way. So it's very nice to know when we're operating in a center where everybody around us is also a plastic surgeon. They've all got different experiences and they all have a lot to offer. So it's not incredibly frequent, but sometimes we will consult with other physicians, a lot of times before surgery, but even intraoperatively. It's nice to be able to know that you have somebody who can come in and take a look.